Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
So what's your take on AstraZeneca? Every day it's been something new.
Well, drip, drip, drip.
Yeah.
Every day is something new. But I think we're kind of missing the big picture here. The big question when we went into this AstraZeneca thing was it causes blood clots. People are afraid to take it. It's going to hurt you. 30,000 patients studied here in the United States and in Chile and Peru. Nothing. No, nothing. Nice controlled trial. There isn't any blood clots. Also, the prevention of severe disease. Nobody's questioning that. And you know what? At the end of the day, what do you care about? You don't want to end up in the hospital. You don't want to die. So this number, 79, 76, it may go down a little more because this is all based on 190 people getting COVID. So if it goes down 3 more points, okay, the percentage is going to go down a point or two. But you know, we got to get over this and focus on what's really important. AstraZeneca vaccine looks like it works and it's safe.
Dr. Murphy, there appears to be a very strong correlation between COVID-19 deaths and obesity. Do you feel that that was something that maybe wasn't emphasized enough at the beginning of the pandemic?
Well, obesity has always come up as one of the factors associated with a bad outcome. That is true. However, you know, when you look at the big picture around the world, why is Vietnam doing so well? They don't have nearly the resources of the rich countries. Then you have Taiwan, you have Hong Kong, you have Thailand, a middle-income country, South Korea, all these Asian countries. What is the deal with them? They just wear masks more or whatever? They're also relatively thin in terms of the population load. So, you know, I think the obesity thing really has to be looked at much more closely because, you know, countries that have a lot of obesity like the United States, United Kingdom, and some of the other European countries, you know, we're having a terrible time even though we have all these resources. So I think it's just something that needs to be looked at.
We've all become familiar with the term variant. Now there's a report of a double mutant. What does that mean?
Okay, so when they get these variants, so everyone I think is mostly familiar with the British one, the B.1.1.7. That has 23 mutations. And it transmits faster and it's a little bit more deadly. So what they found in India, and everywhere you look, there's mutants. If you look, there are mutants because the thing, you know, as long as there's replicating virus, they're going to mutate. In India now they found a double mutant. One is unfortunately the E484Q, which they commonly refer to as EEK because it's a nasty virus. And it escapes the protection from the antibodies from the vaccine and antibody therapy. The other one is the L452R, which causes more rapid transmission. And we don't know about the lethality of that one yet. And these two in the same these two mutations in the same virus. So, you know, again, not a good sign. You know, it was just 2 weeks ago they found those 2 mutants in California, new ones that kind of popped up here. So we have to keep our eye on those, and we have to be more vigilant in doing this genomic sequencing of these viruses because it's going to change.
First viewer question. You stated that if people refuse to get vaccinated, around 25%, we will not get to herd immunity. What if these same people had or get COVID? Can their immunity count like the people who got vaccinated?
So, you know, you get some immunity with COVID, but it's all over the place in terms of how effective it is. But there is some immunity. The vaccine gives you even more immunity. And then if you had COVID and then took the vaccine, you even have even more immunity. I mean, there's a whole gradation here. All immunity, improvement in immunity is good. And the more people that are immune to this thing, the better. It'll slow everything down. So it's all good. But you need the vaccine no matter what.
All right, next question. If my husband and I have both received our first dose of Pfizer, is it safe to have our masks off around others that have received their first dose?
This must be one neighborhood somewhere that everyone got their first dose on the same day or something. They want to know.
Block party.
We're going to barbecue, a first dose vaccine barbecue together. Okay, you know, you play this game like this. After your first dose, within a few days, probably 7 days, you have maybe 50% immunity. You want to play a little roulette here? You know, you could go out to one of the casinos here. your odds are going to be better that you don't get it. But to me, that's not good enough. Wait till you're really immune, get your second shot, or get the J&J vaccine, which only requires one shot. Wait 2 weeks after that second shot, and then go have your party.
I've seen this question a lot. How can I find the Johnson & Johnson vaccine? Seems everyone in Illinois is getting Pfizer, and I prefer the one shot.
Yeah, no, this is a good question. I don't know how they figured that out, but somebody should ask Governor Pritzker, because it was in the newspaper this morning that he got his J&J vaccine yesterday.
He did,
so
yeah.
he would know where it is. Go wherever he went.
Dr. Murphy, good to see you this morning. Thank you.
All right, have a good day.
You too. If you have a question for Dr. Murphy, head to our Morning News Facebook page and post it there. We'll talk to him again tomorrow. Good morning, Paul.